Hey, this is Marty Stempniak, staff writer for Hospitals and Health Networks, and I'm reporting from the American Hospital Association's 29th Annual Rural Healthcare Leadership Conference, and I'm joined today by Todd Linden, President and CEO of Grinnell Regional Medical Center and a member of the Health Forum Board. Todd, thanks for being with me today.
It's my pleasure. It's a great time to be able to kind of talk about wrapping up this bad boy.
So how's your meeting been? How did it go?
Laura and Connie and the whole team knocked it out of the park again this year. We had a great conference, and it was large. I mean, we had to shut off the registration a couple weeks ago, so it was a sellout, but it still felt intimate. You still had that retreat feel. My board members that came along were able to not only hear about some cutting edge stuff and reminding us why we're needing to be transforming our organizations, but frankly, there was also a lot of time to have those kinds of strategic discussions in small groups, share with, and even though, there's this sort of rural nature to this conference, boy, you've seen one rural hospital, I mean, there's still a diversity of folks and what they do and how they do it, and so there's always just learning opportunities every time you turn around.
Any things that you've heard over the past couple of days that you think you're going to start working on at Grinnell in the next couple of months and see if you could implement?
Yeah, I think there was one theme for me that really came over and over again, and it had to do with just, again, thinking about our patients as consumers and thinking about retail and telehealth and ways to make sure that the healthcare we're delivering is convenient, that it's still of high quality and it's safe, but just recognizing that the transformation that's going on right now is real, and especially as so many of the speakers talked about the high deductible plans and people starting to use much more of their disposable income on health, we've got to make sure that we're really providing that value. So I think, as I go home and think a little bit about our strategies, I need to think about it in terms of how we're going to make sure we're delivering that value to our community. I mean, at the end of the day, we're in the quality of life business. Health's such an important part of that, but it goes so far beyond our walls. It's not just when people are sick or injured anymore. It's really about how do we improve health? How do we improve access for the things that families and seniors and kids alike are needing to make sure that their quality of life is constantly improving.
And for the rural hospital leader who's saying, maybe I don't have the money of the bigger guys, or I don't have the access points or of the bigger guys, how can they execute this retail strategy on a smaller budget and with less resources?
Well, there were a lot of sessions that talked about, this notion of do you partner or don't you partner? And if you do, is it a full asset sort of merger, or are there still affiliations and relationships you can have where, you have your cake and eat it too? There's no question there's a lot of interest in rural America about keeping that independence. And yet we recognize that if we go to value-based payment and we need to be thinking about how risk is going to enter into the equation, most of us are not in a position to take on risk. So we need those allies with our urban and system colleagues. And I think there are a lot of experiments going on right now on how that can work. And so this was a conference that gave people an opportunity to hear from some actual examples of things like that and how that's working, as well as, in our keynotes, hearing from folks just talking about the mega trends that are going on. Jamie Orlikoff's always a conference favorite, and he did a great job, again, not only framing why we have to keep transforming, but begin to talk about how does that happen. We talked about performance, talent management. Tom Olivio was fantastic. I really learned a lot in his session. And just this last session from a health economist, again, talking about how important it is for us to start to think about our grocery stores, our schools, our banks. Those are partners now with us as we really think about how we move from a hospital-centric organization really to a community-centric organization. And for so many rural healthcare providers, we already get that. I mean, we the rubber meets the road when you see a patient in the grocery store or at the Ball Diamond with your kids or at a house of worship. It's very personal in a rural community. So this is, and our strength comes from our communities, whether it's our boards, our volunteers. It's that engagement that already is organically happening, but we have to, I think, take it to another level.
Mm-hmm. If there's one thing that you hope that rural CEOs take home and tell to their boards, or that trustees take home and tell to their CEOs, what do you think that would be?
Wow. This was again, it was a very well-designed conference because it really was soup to nuts in terms of where are we now, where are things going, what are some strategies and examples of what you can do. I mean, I literally took pages and pages of notes. So part of my plane trip home is going to be sort of organizing those and thinking about, okay, where am I going to start tomorrow, and what's something I need to be thinking about next week and the week after. And how about as we start to think about our next board planning retreat, what are some of the big themes? And again, I think that was the genius again of this conference, is putting that all together in a several day event that had gorgeous weather. This is the second year in a row where we were having record temperatures, and so going back home to sub-zero temperatures it will be a little sobering, but I'm going to be going back refreshed and with lots of great ideas.
Todd, thanks so much for being with me today.
My pleasure. Have a safe drive. I guess we're flying on the same plane back to Chicago, and then I'm going back to Cedar Rapids from there, but have a safe travel.
Yeah, you too. For HNHN, this has been Marty Stempniak. Thanks for watching.